we move to the ligaments, which are the most commonly injured structure and most common reason why MRI is performed of the ankle. So what are ligaments? Ligaments are structures that connect to bones and stabilize the joint. In the ankle, there are at least 10 to 12 ligaments, but fortunately, they are named after the bones that they connect. And we have the lateral and the medial ankle ligament complex. So what are the bones that form the ankle joint? We have the tibia and the fibula. So there will be ligaments connecting the tibia and the fibula. So these are called as the anterior inferior tibiofibular ligaments, the posterior inferior tibiofibular ligament, and the one between the two is the interosseous ligament. So it's between the two bones, therefore it's the interosseous ligament. Therefore, between tibia and fibula, we have the anterior inferior tibiofibular, posterior inferior tibiofibular, and the interosseous ligaments. Okay. The next set of bones that come into the picture at the ankle joint are the talus and the calcaneum. So the fibula has to be stabilized with the talus, and therefore we have the talofibular ligament. Okay. So it's the anterior talofibular, and then we have the posterior talofibular ligaments. The lower bone is the calcaneum, and the fibula has to be attached or has to be stabilized with the calcaneum as well. So we have the calcaneofibular ligament. So these are attachments with the fibula, and therefore they form the lateral ankle ligament complex. Coming to the medial side, the tibia has to be attached to the talus, and therefore we have the tibiotalar ligament, which is also called as the deep deltoid ligament. Then the tibia has also to be attached to the navicular as well as the calcaneum, and these form the superficial deltoid ligaments. Okay, so we have seen the last ligament that we have to also observe is the calcaneonavicular ligament, and that is called as the spring ligament. So we will see these structures on the MR. Just quickly revising what I just discussed, the ankle ligaments are lateral ligaments and medial complex ligaments. On the lateral side, we have the high ankle ligaments, that's the tibiofibular, the low ankle ligaments, the talofibular and the calcaneofibular, and on the medial side, we have deltoid, that's the superficial and the deep deltoid. Okay, so these are axial images, which are the workhorse for evaluating of the ligaments of the ankles, of the ankle joint. So I will be scrolling from superior to inferior, that's the coronal localizer, and that's the tibia and the fibula. So on the superior most section of the ankle axial image, you would see a ligament connecting the two bones, connecting tibia and the fibula. So that's the interosseous ligament. You can see this jet black structure. This linear structure is called as the interosseous ligament. So it's a high ankle ligament because it's connecting tibia and fibula, and we can see this thin band over here connecting tibia and fibula over here, that's the interosseous ligament. As I scroll more inferiorly or caudally, you would see this is the tibia again, this is the fibula. So the ligament that connects the tibia and the fibula would be the tibiofibular ligament. This is anterior, therefore this is anterior tibiofibular. This is posterior, therefore this is posterior tibiofibular. You would see it again in two sections. This is the anterior inferior tibiofibular ligament. This is the posterior inferior tibiofibular ligament. As we scroll more inferiorly, you would see the C kind of a curve of the fibula at the inferior most section, wherein the tibia has ended and the talus has come into the picture. So this is a thick jet black band of ligament that we can see, which is connecting the talus and the fibula, and it is anteriorly located. Therefore, it is called as the anterior talofibular ligament. Similarly, we will have the posterior talofibular ligament, which has this striated appearance and fat within it, and therefore has this intra-substance signal, which is normal. And because it is connecting talus and the fibula and is posterior, therefore we call it as a posterior talofibular ligament. This is very rarely injured. The ATFL is the most commonly injured ligament in the ankle, and therefore it has to be very well visualized and appreciated on all ankle MR images. Coming to the last ligament on the lateral aspect is the calcaneofibular ligament. It is well appreciated on the coronal, but if you want to see on axial, then you have to find the peroneal tendons. Just deep to the peroneal tendons, you will see a thin band of black structure which is going posteriorly, and that is the calcaneofibular ligament. I will just trace it inferiorly, and you will see it attaching to the calcaneum. The fibular attachment is well seen on coronal. The calcaneal attachment can be appreciated on the axial images as well. So that's the calcaneofibular, and we have seen the lateral ligament complex ligaments. Lastly showing the calcaneofibular ligament on the coronal sections also. I would be scrolling from posterior to anterior. This is the calcaneum. This is the ligament at the calcaneal attachment. As I scroll more anteriorly, you will see this black structure which extends from the calcaneum, and then as I go more anteriorly, you will see the fibular attachment of the calcaneofibular ligament. Okay, so that's all about the lateral ligament complex. Coming to the medial side, I said tibia has to attach to the talus, therefore that's the tibiotalar ligament, also called as the deep deltoid ligament. And again, like posterior talofibular, it has these striations with fat interspersed between it, and that is a normal appearance. As long as you can take a pencil and draw these striations individually, it is a normal ligament per se. As I scroll more anterior, you can see these striations even better. So this is the deep deltoid ligament. Coming to the superficial deltoid, it connects the tibia and the calcaneum, and tibia and the spring ligament. So this thin band of tissue, when you can see it attaching to the calcaneum and extending from the tibia, becomes the tibiocalcaneal or the superficial deltoid ligament. So this is the tibiocalcaneal component of the superficial deltoid ligament. As I scroll more anteriorly, you would be able to see the tibiospring ligament also. So this band of tissue is the tibiospring ligament because it goes and attaches inferiorly to the spring ligament, which we'll see later. So this becomes the superficial deltoid, that's the tibiocalcaneal component. This is the tibiospring component of the superficial deltoid. And as I see the inferior attachment onto the spring ligament, you would see this is the tibiospring ligament, and this is the spring ligament per se. So spring ligament is between the calcaneum and navicular. This is the calcaneal attachment, and navicular attachment is seen in the next slide. And you can appreciate the tibiospring attaching to the spring ligament per se over here. So we have seen the deep deltoid and the superficial deltoid. We would lastly see the calcaneo-navicular or the spring ligament also. This is the calcaneo-navicular. This is the navicular component. There is a small ossicle over here. That is why you can see this os naviculae. This is the calcaneo-navicular or the spring ligament. So we saw the calcaneal attachment over here, and in the next coronal slice, we see the navicular attachment. So that's the calcaneo-navicular attachment, spring ligament. You have to measure the thickness of this ligament in all cases of pes planus and flat foot. Summarizing the ankle ligaments, the lateral ligaments and the medial. Lateral ligaments are high ankle ligaments, that's the tibiofibular ligaments. Low ankle ligaments are the talofibular and the calcaneofibular. On the medial side, we have the deltoid ligament complex, superficial and the deep deltoid.